Hello, I'm Dr. Anthony Colantonio, Medical Director of the Clinic for Specialty Pain Services at Meadville Medical Center. You have been referred for an injection of your sacroiliac joint. The injection is called an SI joint injection since the medication is injected directly into the joint space. The joint that we'll be accessing for the injection is here, right between the ilium and the sacrum. The injection contains steroid, and it is intended to reduce the inflammation and arthritis of your joint. Inflammation and arthritis that are contributing to your pain and symptoms. There is no permanent structural change to your anatomy as a result of the procedure. Therefore, it is expected that results will be temporary. The results can last anywhere between several weeks up to several months. The longer the benefit from the first treatment, the better the prognosis that occasional injection therapy will be adequate for your treatment. Otherwise, you will need to discuss surgical options with your other doctors or consider chronic use of non-narcotic prescription medications. The injection is performed under X-ray to increase the accuracy and safety of the procedure. You will lay in a face-down position for the injection, and it will likely take between 10 and 15 minutes to complete. While you're in the face-down position under X-ray, we will be able to see the joint space and place a needle directly into it. We then inject the medication. If you have significant anxiety about procedures, you can ask about the option for conscious sedation. The risks of the injection include bleeding and infection. These are both very rare. Bleeding is unlikely to occur unless you are routinely taking blood thinners. If necessary, we will instruct you on how to adjust such medications before the injection to minimize bleeding risk. Infection is also extremely rare. It is very important to note that if you have or develop any infection or illness between this appointment and your scheduled injection, that you then inform our office of that situation right away. In that case, your injection will need to be rescheduled. It would not be safe to perform an injection in the setting of an active infection. There are some general risks regarding steroid that you should be aware of. One of these risks is that steroid can have a negative effect on bone density. If you have osteopenia or osteoporosis, steroid exposure could have further negative impact on these conditions, especially if steroid-containing injections are being repeated over numerous times. A single injection is unlikely to result in any significant effect on osteopenia or osteoporosis. However, there would be concern in the setting of multiple repeated injections. It is therefore important that you let us know if you are currently receiving or expect to receive steroid-containing injections at other clinics from other physicians. Another issue associated with steroid exposure has to do with concern for the adrenal glands. These glands naturally make steroid in our body on a daily basis. Our natural steroid is called cortisol. If you are receiving steroid injections on a frequent basis, it is possible that the adrenal glands will shut down, and this could cause a medical condition known as adrenal insufficiency. Finally, it is very common for blood sugar levels to increase after a steroid injection. This is of particular importance for our diabetic patients. The general medical recommendation is that daily blood sugar levels average 150 or below before proceeding with safe exposure to steroid injection. Baseline blood sugar levels will be elevated and may double or greater for up to a week after the steroid injection. This may require diabetic patients to adjust their insulin dosing if they are already prescribed insulin, and at a minimum, be very cautious with your dietary intake for the week after the steroid injection. If we decide to proceed with your SI joint injection, it is advised that you have a follow-up appointment with your referring physician around 4 weeks after the injection. This is an appropriate point in time to evaluate the response to the initial treatment. Decisions about additional injections or other treatment options, including possible surgery, will be addressed during that appointment. Onset of relief from the SI joint injection averages between 3 and 5 days from the procedure.